Hello and welcome back to today's episode of To Me Time. I am your host, Megan, and on today's episode, I'm going to be discussing everything recertification, everything about continuing medical education, about how to stay up to date while you're in practice, in the trenches, seeing patients, and how to manage finding time to complete your continuing medical education so that you can recertify, stay up to date, and not be doing all of this last minute when you're trying to recertify. So nothing really changes, honestly, as far as a lot changes for the amount of hours that you need to do, but just like when you are a bedside nurse or a nurse, once you become an advanced practice provider and have a national certification and you go to renew that certification, you still need continuing medical education or continuing education in order to do that. And I think we all pretty much know why continuing medical education is so important because it keeps us up to date, it keeps patients safe, it constantly is improving health outcomes and the health of our patients. So it is also, which we'll talk a little bit about today, really good for providers to also have an opportunity to do this. It can be really great to have time away from working hours and just your everyday work to stay up to date and to get reinformed again. So we don't there's many different ways you can qualify for continuing education hours so that you can recertify for your license. And you also need hours in order to renew your state boards. So your licensing and your boards where you work, you need continuing medical education to renew that as well. And then this is new this pretty much this past year, but if you have a DEA licensure where you're able to prescribe controlled substances, you as well need an additional 8 hours of continuing medical education specific to opioids and treatment of substance use disorders in order to renew your DEA license. So it can get confusing. That means that you need a lot of continuing medical education, and a lot of nurse practitioners out there are not just certified by one national certification board. They might have two national certifications, and they're not the same CME. So you have to be super careful about reading the details about what type of continuing medical education is allowed for your women's health nurse practitioner certifying body versus your AANP or ANCC or whatever national certifying body that you took your exam with and have your certification through. So it can be confusing, and I would encourage you to take some time to look at the requirements because sometimes you might not be in clinic full time, and that doesn't mean that you don't qualify, but you have to see to so a lot of times with certain national certification bodies, they will accept things such as like teaching hours, precepting hours, writing clinical journals or research that can count. And you just have to look at the nitty gritty details as to what you need for your certifying body in order to renew. And I know for AANP, you need if you are in direct patient care, you need about 1,000 hours of that. You could also have admin hours, or you could be in education. So it's, don't freak out if you're not necessarily in direct patient care, but this is also kind of important to look at before you go to sit for certification for your boards to decide which certifying body you want to necessarily certify through. So that's also something I would recommend doing, especially if you're thinking to go more of like an educational based route. One might be better for you than another for recertification. Also pay attention to the time frame which you need to renew. For my women's health one, that's every 3 years, and then for my for my adult gerontology certification, that's about every 5 years. And then your DEA is about every 3 years, I believe. And then your state licensure is just dependent on your state, and my state is every 2 years. So that's kind of my timeline, but I would definitely know your timeline as well because that might change kind of how you keep yourself organized. So I find that as a nurse, there's just not, you didn't need to keep track of all of it as much because, when you're doing your medical education, I used to just put it in a folder. And then when the time came, I had it all together. But as a advanced practice provider, I would not recommend doing that. I would recommend, and as an advanced practice provider that has two national certifications, I would definitely recommend being very organized. So Now, what I do once I complete any continuing medical education or continuing education, I document it right away. I download everything I need to have. I keep a copy of it on my computer. I go ahead and upload it to my national certification body. So it's already on there. And I don't have to think twice about it when I go to renew because it's all kept there. And then I have a second copy somewhere in my computer or in my records files that I keep. So I would definitely recommend doing that right away because it just kind of consolidates everything. And if you are like me, recertification is a little stressful, especially if you're going through it for the first time. You want to make sure it goes through smoothly. You don't ever want to have to have any issues with it. And you just want to make sure that you have all the information there that's required so nothing gets kicked back, because that can prevent you from being able to practice. And that's a big deal. As we all know, like when you're a nurse, if you don't have your ACLS or your BLS, you cannot practice or you can't go to the floor that day if it is expired. You have to keep that up to date. There's certain requirements that you need to have that are up to date. Now, sometimes if you maybe took a break or didn't take a job right away, working in some capacity as an advanced practice provider, you can also sit to recertify by retaking the exam boards. That's always an option. I don't know anybody who would want to do that, but if that is you, go for it. If you would rather do that, that sounds like an interesting option. But I would just encourage you to take advantage and do this continuing medical education portion of it. Now, I want to take some time because I wish I knew more about continuing medical education or continuing education as a nurse. As a bedside nurse working in the hospital, that was when I first kind of got introduced to it. So at first it was more just, whatever my hospital offered was really what I did. I, of course, would use my CPR, my ACLS, and then whatever type of like wound care, whatever my hospital had available for continuing medical education, I would complete because it was free, it was there, it was in front of me. I didn't really understand that a lot of hospitals give you continuing medical education days where you actually get time away from work that week, where you could be at a conference or on a video conference or doing some type of continuing education that day instead of working on the floor or working at your job as a nurse or for NPs, this is the same thing, but specifically for nursing. And you even sometimes get a stipend for that too. So I didn't know this until my manager. I was really involved in like practice improvement on my floor, and the quality manager kind of was like, "Hey, Megan, we have continuing education days. If you're interested, you should go to this conference." And so I I don't know why my world was not open to the fact that there's like huge, massive conferences of nurses that get together. Or I guess I was never really super interested at my very, very beginning of my career because it's also new. I feel like going to work every day was a lot as it was. But I would really encourage anybody who's a nurse and that's looking to fulfill their CME to really think about maybe going to one of these national conferences. I loved it. It really was a pivotal moment for me in my career as a nurse, and really pushed me to really consider going back to get higher education and go back to obtain my master's and get my MSN. And that was a huge push for me. I just was blown away by the sheer volume of like how many healthcare professionals, specifically nurses. I went to the National Teaching Institute conference for critical care nurses. So I went to NTI. And I still remember it was my first conference. It was awesome. I was like, this is so cool. There are so many nurses here. Most of them are in critical care. They had these booths everywhere, speakers. You could go to whatever type of topic you wanted to learn about. There was stuff about professional practice. There was speakers on ethics, speakers on all different specialties of nursing. There was even procedural skill days where you could work on procedures. You got to play with equipment that maybe you haven't had an opportunity to be exposed to. You could also go and learn different types of equipment that could be available to your hospital that maybe would be more effective for your type of patients that you might like to have. It was pivotal and it was great. I got to really get to know some of the speakers. I got to meet some other nurses. It was awesome. I loved it. And that really opened my eyes to, wow, there's a whole world that is focused on just education and focused on research and quality. And I don't know why that didn't click until when I went to the conference, but it did. And I just thought it was a really neat thing to be a part of. And I was able to, I think at the time I had like a couple days where they would pay for a couple of the days and I had to pay for some. And I was okay with that. And even though I think I went like 2 years later and I went back to NTI and I didn't even have like any type of continuing medical educational support. But because at the time I was a travel nurse and I was like, no, I loved that conference so much. I went as many times as I could, which was fun. And now as a nurse practitioner, I would encourage everyone, if there's an opportunity to go to a nursing conference, it's just a special opportunity to have. And if you've never experienced it before, I think you would really enjoy it. So if you haven't been, look into them. And of course, that's not the only way you can get continuing education. So continuing education's a great opportunity. And then when we're talking about nurse practitioners, this is something you should definitely ask your employers while you're in the interview process. And you should ask for RNs too, one, how many days do we get? How many days are allotted to my continuing education moving forward every year? And what is my compensation for that? Usually employers are giving some type of financial compensation. It's not going to cover like this big grandiose vacation that's for CME, but it's going to give you some help flying there or registering because they're expensive. Some of these are. So that's going to help cover the cost of some of these medical education expenses as well. And so you want to look for that for an employer that offers that. Most of them do. Some are better than others, of course, especially if you're working for a bigger institution. And then I would suggest if you don't get any continuing medication hours, I would ask or negotiate for more days of paid time off so you're able to do that, or somehow negotiate so that maybe you come back and you present what you learned to your clinic in a very concise manner, and possibly they'll compensate part of your registration fee, or will give you time off in order to go to that conference or whatever topic of continuing education you want to have. So lots of opportunities for ways that if you don't get it directly from your employer, just ask or negotiate and see what they can do. I feel like most of the time they're going to be pretty open to that because it's a really important thing for providers and all medical professions to complete. So it's your time away. It's important because it's your time away from work where you're not in direct patient care, seeing patients on a day-to-day basis. It's your time to sit, learn, and pay attention to what's being presented and to absorb the information and to really ask questions that you might have and to connect and collaborate with other colleagues. Because when you come back, you're going to feel rejuvenated. You're going to feel like you have a new vision. You are able to better care for your patients and hopefully improve the health of your patients. Also, you might share some of this information with your colleagues or go back and present with your clinic. It's a motivating, relaxing time. It is really hard to do continuing medical education after a long day at work where you maybe stay late to chart and then you have to come home and complete CME, or there's a conference you want to go to. So it's just hard to kind of cram that all in. Of course you can do that, but I like the idea of having a day off, and it's a day away from clinic that they pay for, that they give you. So use it, use it, use it, use it. It is there to be used. The other thing is you don't even have to travel anymore. A lot of people get because traveling can get expensive, it can all start adding up. Or if you live in a remote place or you have family obligations where it's not possible for you to get away for continuing medical education, like a conference or a full week or a full 2 days, there's so many options to now do this online where you don't necessarily have to be present in person, but definitely have an opportunity where you can focus and take advantage of that. And that's just like a really fun thing to do as well. The other thing I want to mention is that certain national certifying bodies have different continuing medical education requirements. So you have to pay attention to the type of continuing medical education you're doing. I kind of mentioned that at the beginning of the video, but I mean that even if you're doing a continuing medical education that's like in a certain format, check what certifying bodies they have credit given towards, because it might not include yours. So even though you like that form of education or that form of knowledge, you just have to make sure that's actually something that your certifying body recognizes, so that you're not sitting there clicking your renew certification and you don't meet any of the requirements, even though you did lots of continuing education, because it's not recognized by your certifying body. So that's something you want to check on when you're doing some of these more I like to call them like easy grabs. So those easy grabs are the journals that you get in the mail. The easy grabs are the podcasts that you listen to, or it's like the up-to-date articles you get credit for. So just pay close attention to that. And there's even rules about like ACLS and CPR. You can use that once in your 5-year span. So you just have to pay attention. The other thing is oftentimes your certifying body might dictate how you do your CME. So what I mean by that, you might not to be able to do it all on one topic. Obviously, your national certifying body doesn't want you to do that. So, for example, my women's health one, I take a certifying exam when I go to renew. Depending on what I'm pretty sure this is like how it works, but depending on what I get, they're going to suggest certain amount of hours in each topic that I have to complete my continuing medical education for. And there's a couple of different topics, and that's always the core of this certifying body. So you're always going to have X amount of topics in each category, and it's broken up between things like pharmacology, assessment, professional practice. So there's different sections so that you're really getting a more robust continuing medical education than just focusing on one thing. I don't think nursing I definitely know that my state boards, when I went to renew my RN license, they don't ask for that, but usually the national certifying bodies will ask for that. Some are more specific than others. My adult gerontology one, I do know that like 25 of those hours of however many I need to do of the 100 need to be in pharmacology. So there's definitely requirements there. And most of the time there is a pharmacology requirement for your hours. So just know what those hours are. Most of the time, if you're going to like a conference, they're going to have a wide range so that you have enough to cover multiple areas. So they're like well versed in all this, and it's well known. So this is all ways that I would say find your way that you want to consume your medical knowledge outside. Try to make it a priority. Try to plan it so it's fun. Maybe use this opportunity to go hang out with your other your students that you went to school with. And now that you're all in professional practice, you can all hang out together at a national conference. Conferences are a great way to collaborate and to network with other providers across the country. So that's really something cool that you can do as well. And then if you're really active in one of the professional organizations, they oftentimes put on a lot of continuing education that you can look at too. So this is just a little tidbit about recertification, continuing medical education, and I hope you found it helpful. If you have any questions or need clarification on something, I'm happy to see if I can help. You can message me on Instagram at @tometime. And of course, please don't forget to like and comment and maybe share with another provider that might be interested in hearing more. And thanks again for tuning in, and we will see you guys next time on To Me Time. Bye.